Hello everyone, in this video we are going to discuss about mechanics of breathing. So we know breathing consists of both inspiration and expiration. So what happens during inspiration is there will be first diaphragmatic contraction and the diaphragm will move downwards. Along with it there is external intercostal muscles contraction. Because of this external intercostal muscle contraction, the ribcage will move upward and outward. So there are three movements during this inspiration, that is piston movement, bucket handle movement and the pump handle movement. Piston movement is nothing but whenever the diaphragm contracts, it will move downward acting like a piston. So here there will be increase in the vertical diameter. Next is bucket handle movement. Here when the external intercostal muscle contracts, the ribcage will move upwards and outwards. So there will be increase in the transverse diameter. This is like a bucket handle. So bucket handle movement is seen. Next is the sternum also moves upwards and forwards causing pump handle movement. Here there is increase in the anteroposterior diameters. So overall there is increase in the vertical diameter, increase in transverse diameter and also increase in the anteroposterior diameter. So overall there will be increase in the thoracic volume, and because of this there is increase in the lung volume and the alveoli will expand. So we know according to the Boyle's law there is pressure is inversely related to the volume. If the volume is increasing means pressure will decrease. So the intrapulmonary pressure will decrease. It will fall below the atmospheric pressure. So we know air moves from high pressure to low pressure area. So it will move from the atmospheric air to the lungs. Next is during expiration. During expiration this diaphragm will relax and moves upward, and the external intercostal muscles also will relax and the ribcage will drop. This causes decrease in the thoracic volume. So the volume is decreased means intrapulmonary pressure will rise above the atmospheric pressure, and the air will move from high pressure to low pressure. So here it will move from the lungs out into the atmospheric. So this is exhalation. But during forced expiration, generally the normal expiration is passive. But in forced expiration what happens is there is involvement of this abdominal and the internal intercostal muscle contraction. It is generally seen in exercise, coughing and also in asthmatic attacks. So in inspiration there is external intercostal muscle contraction and also diaphragmatic contraction. The ribs will move outwards and upwards. The diaphragm will move downwards causing piston movement, and the sternum will move upwards and forwards. And next is during expiration that the ribs will move inwards and downwards. The diaphragm returns to its position. And during forced expiration there will be contraction of this abdominal muscle and the internal intercostal muscles. So what the normal pressures in the atmospheric pressure is generally outside the air, which is 760 millimeters of mercury at sea level. The intrapulmonary pressure will change during inspiration the pressure will decrease, during expiration the pressure will increase. So during inspiration there will be movement of air from the atmosphere into the lungs. During expiration, because of this increase in the pressure, there is movement of air from the lungs into the atmosphere. The intrapleural pressure will always be the pressure in the pleural space will always be negative to prevent the lung collapse. This negative pressure is lost in cases of pneumothorax. So this is the mechanics of breathing.